Hello, this is an interesting case of tunnel-free Z-poem combined with balloon dilation of an upper esophageal stricture. So here we have an 85-year-old lady who has severe symptoms of dysphagia and respiratory symptoms and significant weight loss of more than 30 kilos over several years. We have a huge Zenker's diverticulum over more than 4 centimeters in depth, and here we have a stricture of the upper esophageal sphincter. So this is pretty rare. I have never experienced that before. Just the catheter is able to pass through the upper esophageal sphincter. So this was a tight stricture, and we plan to do a Z-poem and then manage the stricture with balloon dilation. Here we start with injection over the septum, and then with a dual knife 1.5 millimeters I do an incision over the septum 1 centimeter about in length, just enough to fit the cap of my endoscope. I use 1500 endoscope by Olympus and an ST hood. Here I try to isolate the septum. I do injection with the dual knife at both sides of the septum, and then we proceed with incision. In this case, I think standard Z-poem is not feasible, so tunnel-free Z-poem, as described by our team in endoscopy recently, is applied. So here we cut directly the cricopharyngeal muscle, and once you have cut 1 centimeter, then the dissection field expands, and it's very easy to isolate the muscle in the middle and do injections around the muscle. Here the muscle is easily identified, and injections are provided with a knife, and we go deep into the Zenker's diverticulum, at least 4 centimeters. The difficulty here is that you cannot evaluate correctly the depth because we have no info of the length of the diverticulum by entering the esophagus. So at this level we consider that the myotomy is deep enough, but now we have to proceed to dilation in order to evaluate the esophagus from the outside. So this is the pouch, and now we're going to use a balloon of 18 millimeters in diameter, and a brave dilation is done. So dilation at 18 millimeters, and then we're going to advance our endoscope and evaluate the discoloration of the esophagus and see if the discoloration goes deep enough into the esophagus. We need at least 2 centimeters beyond the end, beyond the bottom of the diverticulum, in order to diminish the risk of recurrence. And by saying that, I have done about 30 cases of Z-poem. We have no recurrence yet, and I think the clue for that is that we go deep into the esophagus. So balloon dilation is done, and now we're going to check if the dilation has solved the problem of the stricture, and the most important step is to verify whether we have done any mucosal damage at the side of the diverticulum. So here we proceed with endoscopy of the esophagus. The discoloration goes deep enough, so myotomy is probably enough, and now we inspect the area of esophagus of Z-poem to see if we have any damage. There is some mucosal damage, but this is at the opposite side, It's not at the side of the Z-poem, so this is not an issue. Everything looks nice, and the next step is to place some clips. And when placing clips, it is very crucial to avoid clipping the esophagus, to avoid clipping the opposite side of the esophagus. So here we start clipping, and every time that I place a clip, I advance my endoscope into the esophagus to see if it is obstructed or not. In that case, you have to remove the clip and place a new one. So several clips are placed, and every time I advance my endoscope to see if the patency is good. This patient will be called 2 months later in order to remove any remaining clips, because they are not useful anymore and they can provoke dysphagia or even pain. So 2 more clips are placed at the bottom and at the tip, and we're done. So that was a tough case of Z-poem in the setting of upper esophageal stricture. This patient was hospitalized for 1 day, CT scan next day was normal, and at 40 days of follow-up she's doing fine. She started gaining some weight and eating normal meals again. Thanks for watching. See you soon.